Epic Mobile Healthcare Apps, My Charting. Epic has integrated a healthcare mobile app for Androids and iPads, and one of the apps, launched by My Charting. My Charting is a secure online health management that connects patients to their electronic medical records 24/7. Patients can activate and improve their own health by reducing the cost of customer service and provides communication links to support care with their providers. They can view their upcoming and past appointments. Patients can view their test results. They can fill out their pre-visit questionnaires, review allergies, and update their medical records information. They also can request prescriptions and view their medication lists. They can request an appointment for measures such as mammograms, colonoscopy, flu shots, and when other providers that do not have electronic medical records such as Epic's, they can download it to their flash drive. Patients appreciate this type of service, which convenience of managing their own health care through the Epic My Charting on their mobile phones and their iPads. Epic targets large organizations with structured methods for extending a shared record system to independent physicians, practices, and community hospitals. Epic System has implemented a partnership with Apple for a mobile phone-based electronic health records to lighten with Epic System iPhone application, HandCool. HandCool is working on an iPad device to increase the screen size to help clinicians to use these images for making diagnostic decisions. Healthcare providers see this as a platform means to connect with their patients. The HandCool, it gives physicians portable access to patients' charts, whether they're in the hallways of their practice or in a hospital making rounds. The Can2 physicians access for iPad. They use the dashboard to check the patient's schedule, respond to messages, and get information on patients before entering the patient's room. Whereas the Lucy is only connected to a facility and it stays where the patient, wherever they receive their care, because they don't have connected to electronic medical records. Whereas the Apple has unveiled a tablet device. It looks like a giant iPhone. It holds a promise as a new point of care tool for healthcare workers and personal health devices for patients. The Apple iPad Touch has an advantage over other medical tablets. It has a built-in application library of almost 5,000 healthcare apps, and one of them is My Charting. Apple's offering an iPad at the cost of different prices. With Wi-Fi and no cellular connection, you can have a 16 gigabyte costing $499. The 32 gigabyte is for $599. Apple is presently working with AT&T to offer two data plans, one which costs $14.99 a month, and it gets up to 250 gigabytes. The unlimited plans cost $29.99 a month and requires no contract, whereas the user can cancel at any time. Policies and procedures. Epic Mobile My Chart is fully compliant with the federal and state pertaining to patient privacy. The patient's names and email addresses is treated with the same care and privacy given to their health records. It will never be sold or leased by My Chart. When the patient logs on to My Charting, they have to use a code, and it expires within 30 days. When the patient is not using it, it automatically deactivates and logs the patient off. The patient has to develop their own ID and password when they first log onto My Charting. To measure the efficiency of the mobile app My Charting, a questionnaire is developed asking patients questions such as, was it useful? How was it useful? And would they recommend it to their family and friends? I would market the Epic mobile app to physicians by demonstrating to them how beneficial My Charting and other healthcare apps would increase their productivity and how they can have easy access to My Chart. I would inform the providers that iPad has a nice screen size, is lightweight, and that it has easy access and connected to Epic. They have everything they need in their exam rooms or at their hospital bedside. I would educate the patient by, well, as they sit in the physician's waiting rooms, I would have them turn on the television, let them see how they can easily access their electronic medical records by using my charting. You know, these education TVs, they play continuously, and there'll be a demonstration how they can use it, and so they can see that they can connect with their providers using my charting. The mobile app iPad is the newest technology to improve healthcare, to help patients be involved with their healthcare.